This is surveyor training for what we call the 9-county survey. So let me start out with some background information and then we'll get to the details of the survey itself. So this is a research collaborative between Dr. Leslie Hosfeld and Dr. Sarah Griffin. Dr. Hosfeld has funding from Blue Cross Blue Shield, South Carolina, and she is working in Barnwell, Allendale, Jasper, Oconee, Chester, and Greenwood counties. 6 counties there. Dr. Griffin has a CDC grant that's working in 3 counties, Hampton, Lee, and Marion. And together we have these 9 counties total that you can see cover all areas of the mid-state of the state of South Carolina, upstate, Midlands, PD, and the Low Country. So that's where we're working. And so that's where your calls will be made to individuals who live in communities within those counties. So here's what you need to do first. The first step is to communicate with the appropriate faculty member or staff member that is your connection to this project, and let them know that you want to be a surveyor. They're going to put you in touch with me for the training, and you'll be watching this recorded video. The next step is for you to complete any required paperwork that you have to ensure that you get class credit for your participation or that you're paid monetarily for your time. People have different arrangements on this project, so whatever is appropriate for you. The next step is for you to complete surveyor training. This is part of your surveyor training. I might be leading that. You might be watching this recorded video, or you might be training with someone in person, another person on this project who's qualified to train you and get you up to speed. The next step, and steps 3 and 4 could be done in different orders, but you need to make sure that you complete the city training and provide us with a link to that certification or a PDF document that shows that you have completed the city training. So here is a link to the homepage for the city training. Once you go there, you want to register yourself and create your account, and be sure that you affiliate with Clemson University. You should be able to find that in a drop-down menu. You're going to find that there are a number of courses there, and it may be confusing, but you want to complete the social, behavioral, and educational, which is misspelled here, basic course. The SBE basic course, that's the one you want to complete. And just so we make sure you get there, I have included that URL here for you. So the city training is the institutional review board or IRB training that you have to complete before you can be officially added as a member of our team, before you can collect data with anyone or participate in any way where you have direct contact with a study participant. You have to be city certified. That has to be on record with Clemson University, or for those students who are doing this at Lander University, on file at your institution. And you have to be officially added to our team before you're allowed to do any work whatsoever. That's very important. By the way, for those who are undergraduates and even graduate students who are being trained, this is a nice thing to put on your resume. So not only do many of you want to document that you have a research experience, you can also add this to your resume, and it's a nice little addition for when you apply for graduate school or medical school, or if you go on to do work with someone else. Even if you go on to do work in the biomedical world, there's another basic course that you can do for that. But just having the city certification is a really good training for you in general, and it's a nice little resume builder. All right, so a little bit about the process. I want to give you some big picture background here so that you know how everything all fits together. Now, what you're primarily tasked with doing is getting in touch with individuals that we assign you to and completing the interview with them, documenting their responses. And there are a few notes that you have to make along the way as you do that, and to wrap up the process for each person that you complete an interview with or complete a survey with. But I want to give you the bigger picture just so you understand what's happening. So we have community partners all around the state that we work with. Some of these community partners are Clemson employees or related to Clemson programs that are out in the community. Some of these partners are just various state or regional agencies that have something to do with health or food or older adults, etc. So we have a lot of community partners that link us to, they either provide us with names of individuals that we can do the survey with, or they link us to other places within the community like churches, schools, those kinds of things where we can actively recruit individuals to complete the survey. So in terms of that, that's going on all the time. So you don't have to worry about that. That's not part of your task. But one of the things that you need to do while all this is going on, and one of the first things you need to do, and I'll talk about this a little bit more at the end of this recorded training, I need to know when you're available to make calls. What are the days that you can make calls, and what are the times that you can make calls? Now, some of you may be dedicated to this project 5 hours a week. Some of you may be dedicated to this project 20 or more hours a week. Don't give me the days and times that you can call that are constrained, especially to a small window of time. So for instance, if you're working 4 or 5 hours a week on this, give me all of your available time. It will be up to you to determine when you actually make those calls and do your 4 or 5 hours or your 20 hours or whatever your arrangement is. But I need to know when you can make those calls so that I can assign individuals to you based on when they prefer to be called. Now, if for those Lander students that are doing this, you're going to work with your professor. You won't go through me on this per se. So that's a little bit different for you, but it's important that you let whoever your primary supervisor is know when you're available to make calls so that we can coordinate assignments to you. So once I know when you're available and we get in touch with individuals from the community and we document the best days and times to call them, the best number to reach them, that's when I will go into a spreadsheet that I'll show you shortly and make assignments to you. Once you do your interviews, you will enter that interview data either in real time as you do the survey with the person by phone, or you'll document that on a hard copy printout and then you'll go back in and enter it. We'll talk a little bit more about that along the way. But there is an Excel file that you need to go into to document if you attempted to call a person 3 times and couldn't reach them, if you completed a call with them, you'll need to document their mailing address for the incentive card that they receive. So there's a lot of people that go into this online spreadsheet. So I go in on the front end and and enter information for individuals that we can call in the community. I make assignments to you, and actually other people enter community contact information into that spreadsheet as well. My main job is to help keep that organized, to make assignments And then once you as a surveyor complete a survey or do your attempts or whatever, you make your notes in that Excel file, which we'll look at shortly. And we have a project coordinator who goes into that Excel file, and when someone has completed a survey, this person will mail out an incentive card to them to their home address or the PO box that they provide to you when they do the survey. So that's big picture overview stuff. And now we're going to get into some details as we move along. So just a quick little reference for you. This is the information that we need to put a person, an individual to be surveyed into our spreadsheet and to do an initial screening of them to make sure that they're eligible. We have to have their first and last name, their phone number. We have to have their mailing address. We also have to know what county they're in. That's very important. You can't see that here, but you will see it in the Excel spreadsheet. This is just an example. What days we can call them and the best times or blocks of time or time of day to call them. So screening and informed consent. The first thing that you're going to do is look at the first 3 items in the survey. And let me just pull that up right now. So box.clemson.edu, that's the address you're going to go to. I've got that information included in this training as well. You got to do the 2-factor authentication thing. And you should be familiar with that from your classes and doing other things with Clemson. Now, what you're seeing on my screen right now is all of the files and folders that I personally have access to in Box. So yours is going to look different, but you will have a folder that's called Food and Wellbeing Survey 9 Counties. That is the folder that you want to go to, and that's the one that I will share with you. I'll put your email addresses in here, share that with you, providing you access to this in Box, giving you permission to get into this folder. So Food and Wellbeing Survey 9 Counties, that's the folder we want to go into. So let me just show you really quickly the Community Survey Recruitment Payment and Tracking Form. And this is, I have this actually saved locally on my computer. So you can see what's in this Excel file. The first column documents where we made this connection. You're actually going to ask them that at the end of the survey as well. So we have double documentation of that. What is the person's name that you're speaking to? What is the best phone number to call them? The county of residence, their actual mailing address, best days and times to call, and who is assigned to that person. So you want to be looking for the header that says interview assigned to, and then look for your name. As you complete the survey, you're going to indicate yes. Or if the call disconnected or if it was a wrong number, you can see some information here. This is actually an older version from a little more than a week ago. Attempts that are made, if a person says, no, I don't want to do this, etc. This is your notes column here. And then we have a project coordinator that goes in and indicates when incentive cards go out. And this is old enough that none of the incentive cards had been out yet. So that's just a quick view of the Excel spreadsheet. We'll talk more about that in just a minute. But there's a lot of other files in here too. And what I want to point your attention to are several files here about the 5th one down here shortened food access PA stress community assessment survey. We've got a PDF and a Word document version of that. And then we have basically the same thing underneath that, 2 files. The difference between these 4 files, aside from being either a Word document or a PDF, is that the quote shortened file is compressed, so it's on fewer pages. So if you want to print this off, you want to use the shortened one. But what is actually contained here in the shortened or the original survey is all the same survey questions. You have everything there. Now, if you are doing the survey on Qualtrics, you simply just follow through the screen prompts. You don't have to look at this. But if you're documenting a person's responses on a hard copy form, you're going to want to have one of these handy or printed off. So that's accessing the files. Let me now bring up PDF copy of the survey and get back to where we were. So the first 3 questions are screening. And what you want to do to create a unique identifier is you're going to put the county code in there, the last 4 digits of their phone number, and your initials. And then here are your 3 screening questions. In what county do you currently live? So these are the 9 counties. We have an other here, but that really shouldn't be used. But you're gonna select through the screen prompts on Qualtrics, or if you're using a hard copy, you're gonna select the appropriate county here. If they answer anything other than these 9 counties here, then they are not eligible to do this survey with us. Keep that in mind. So they should have been screened up until the point that they're assigned to you, but it's possible that someone could get through. We're trying to do about 1,300 surveys total. So, you know, something can fall through the cracks. But if they don't live in one of these 9 surveys, you're going to end it and say, I'm sorry, if you live in Richland County, we don't have permission to do surveys with people in that county, only these other 9 counties. So once they get past this step, you're going to ask them what their zip code is and enter that in. And then the third question is, where do you typically shop for food? Like, what's the main place that you go to? Now, you may have individuals who say, I shop all over the place. I try to find the best deal. What you would do then is you would ask them, what is your number 1 go-to place? Like if you were going to run out and get some food right now, where would it be? What city or town is that in? And what's the name of that store? Now, notice you've got a prompt here to read the consent form. So let's go back to here. And let me share this back on the screen. So we've gone through the first 3 items, and this is essentially the screening step. So these steps are in place to determine whether or not the person can do the survey with us. Once that is determined as a yes, then you do the informed consent with them. So here's what the informed consent looks like. You're going to paraphrase this. It's a 2-page document. And by the way, this document will be mailed out to them with their incentive card once they complete the study. It's federal law that and IRB protocol that you have to provide any research study participant with a copy of the consent form. So here's what you're going to do. You're going to paraphrase what we have here. You're going to say that this is the Hunger, Food Security, Physical Activity, and Stress Community Assessment Survey. And this says it takes about 15 to 20 minutes. We're telling people, just so you know, we're telling people that it can take as much as 30 minutes. Just some of these are running a little longer, and we don't want anybody to be surprised. So make note of that, and just let them know that just say 30 minutes. Tell them that the purpose of this study is to better understand eating and physical activity behaviors. And we want to know if the current pandemic has made any impact on those things. You have to let them know that they can choose to not answer any question, although we would like for them to answer every single question that we ask them. They also have the right as a participant to stop at any time, but if they don't complete the survey, they won't receive their incentive form. But we have to make sure that they understand their right to say no to any single question. We have to make sure that they understand their right to stop at any time and not be forced to continue. And essentially, that's really what you need to say. You don't have to really get into anything on this second page here, but I've got the entire consent form here for you to be able to see and to read through. All right, so let's get into the survey section. So these are the different sections. We've already gone through the screening. The first section is food access. Next one's food security. Then we have eating behaviors. Then we have physical activity. We've got neighborhood questions. We've got more physical activity questions, stress questions, questions about their community and neighborhood, and then we've got some demographic questions at the end. Notice the plus COVID on really all of these questions or sections of the survey. That plus COVID is 1 to 3 questions where we're essentially probing to see if their food access, their physical activity, their interactions with people in their community and neighborhood have changed as a result of the pandemic, and if so, how? So the primary thing that we want to know from our survey are these sections. We want to know about people's access to food, food security. Do they have enough to get them through the end of the month? What kinds of things are they eating, physical activity, etc. Secondarily, we want to know if the pandemic has impacted that at all. So I've got this broken out into sections and items. This is more detailed than you really need to know, but I just want to show you how this all works out. So we've already done the screening. Remember, that's the first 3 questions. And if they're a yes, if they're eligible for the study, which is essentially the first question, then you move forward with the consent form. Now, the first section of the survey is after that initial 3-item screening section is food access. So we've got a block of questions that are related to food access. And in a nutshell, we want to know where they shopped for food and if COVID-19 changed that, how they got their food, or excuse me, how they got to their food shopping locations and if COVID-19 had any impact on that. And then lastly, did they receive food from assistance programs or sources outside the home? And did the pandemic affect that in any way? That's kind of a quick summary, but there are multiple items under each one of those themes, if you will. All right, so let's take a look at that section now. So what I'm going to do is I'll spend a little bit of time going through this at first, and then I'll go a little bit faster. So what's going to happen is I'm going to explain in great detail how to do this, what you're looking at here, etc. But as we move through the other sections, I won't need to repeat all that. So for this first section, you'll see a block of items that we have here under 4. So even though this says item number 4, it's actually what? 1, 2, 3, 4, 5, 6. It's really 7 different things that we're asking them here, right? But this is all one group together, and they're grouped together here because we want to know how often the person you're interviewing or members of their household shop for food during the last 3 months at these different places where you can get food, okay? So I'm not modeling the survey to you just yet at this point. I'm still explaining, okay? So we've got grocery stores, we have what's called partial markets, we have specialty stores, convenience stores, etc. So there's 7 different places or kinds of places where you can get food, and we're asking about those. And we want to know if they would say that in the last 3 months, they never bought food there, they sometimes bought food there, they often bought food there, or they always bought their food there. So obviously that answer can be different for these 7 different types of places to get food. And that's okay. But we want to be clear on what we're doing here. Now, I'm going to model for you here in just a second how to do this with the person that you're on the phone with. The last thing that I want to point out, though, is that when you offer them these response options, which they can't see, by the way, because they don't have a copy of the survey. So one of the challenges we have here is that, they're just reacting to what they're hearing on the telephone and trying to answer you, and they don't have that in front of them. When you offer response options to them, don't verbalize do not know or refuse to answer. And that's grayed out so that you will remember not to read those options to them. Now, if they just can't answer that, or they refuse to answer it, or they don't know, you probe them a few times and they literally can't give you an answer, then you're going to have to use one of these response options, do not know or refuse to answer. And really, it's a judgment call on your part. But we don't offer that as a response option because we only want to use that if it's clear that the person can't provide you an answer for whatever reason it is. It doesn't matter. But you have to decide, is it a do not know, or is it a straight up refusal for that particular item, which again, they have the right to do. All right, so let me walk through this and model for you how I would do this with someone I'm on the phone with. So after we go through the screening, I do the consent form with them, and I let them know that a copy of the consent form is going to be mailed out to them with their incentive when they complete the survey. I would do something along these lines. And notice how I try to be very conversational when I do this. So I don't sound like a robot reading these questions. So I don't say, please indicate how often you or members of your household shop for food during the past 3 months at the following types of food stores: a supermarket or grocery store. Examples would be Aldi, Ingles, Bilo, Publix, Walmart, etc. Would you say I never bought food here, I sometimes bought food here, I often, or I always bought food here? So there's a lot of things that I did wrong in what I just modeled for you. The first thing is I went way too fast. The second thing is I did not provide good information for them to be able to give an answer. And I wasn't very conversational in nature. So one of the things that you're going to want to read this as a script initially, and it'll just take a little bit of practice for you. And then sooner or later, after you do a few of these interviews, you're going to become familiar with it, and you kind of develop your own personal flow for the way that you do these individual items in each section here. But here is an example of how to do this the right way. Okay, Ms. Smith, we're going to actually start the survey now. You ready to get started? Okay, let's do this. What I'm going to do is I'm going to set up this question for you that I want to ask, and I'm going to ask you about 7 different places where you might buy food in your community, where you yourself actually go. So here's the background. Let me give you this background real quick. I want you to tell me how often you or members of your household shop for food during the past 3 months at each one of these different types of food stores I'm going to ask you about. Does that make sense? Okay. So the first kind of food store or place where you can buy food that I want to ask you about is a supermarket or a grocery store. So an example of that might be Aldi, it might be Ingles, Bilo, Publix. Even though Walmart is a bigger kind of store, it has a grocery store inside of it. So you could think about that. Some communities here in South Carolina have Piggly Wigglies. So we're talking about grocery stores now. So I want you to tell me How often you or members of your household shop for food at grocery stores during the last 3 months? Would you say, I never bought food here at a grocery store? I sometimes bought food at a grocery store. I often bought my food at a grocery store, or I always bought my food at a grocery store. And I'm stepping out of character now. They may ask you to read that again or tell you the response options again. But after they do a couple of these, people typically catch on and they know what to say. So once you get through that, you're going to say, okay, next I'm going to ask you about what we call partial markets. Now that word may not mean a lot to you, but I'm going to tell you what I mean by that. What I mean by a partial market is like a Walgreens or a dollar store or a CVS. So this is a kind of store that's primarily something else, but they have some food there. So unlike Walmart, where you can buy all sorts of things, but they have a full grocery store there, this is a different kind of store that has a few food options. Okay. So Walgreens, dollar store, CVS, these kinds of things. How often did you or members of your household shop for food during the last 3 months at one of these places? Would you say you all never bought food there? You sometimes bought food there? You often bought food there? Or you always bought food there? So again, if this is a really sharp, and I'm out of character again, by the way, if this is a really sharp person and an astute person, they may remember those four options. You'll see that. But there may be older adults or people who are a little bit slower to catch on and remember all four of these, where you have to pretty much repeat that every single time. So I won't go through these in that much detail for all seven of them. But the next one is, you would say, okay, Miss Smith, now I want to ask you about what we call specialty stores. So this would be a place that sells a certain kind of food. So like an Asian food market or a Mexican food market, or something along those lines. Would you say in the past 3 months, you or people that live in your house never bought food at places like this, sometimes bought food, often bought food, etc.? You would go all the way through, and you might get through those first couple of options and they might just blurt out, never. I never go to those kinds of places. You're done. You move on to the next one. Okay, Ms. Smith, next I want to ask you about convenience stores, carry out, or corner stores. So these are like gas stations and other things like that. So just a quick place you can run in and out. And then you do the four options. Okay, next, Ms. Smith, I want to ask you about fast food restaurants or food trucks. So this is a place where you can get food quickly. You do the four options. How about farmers markets or produce stands? In the past 3 months, how often did you or members of your household shop for food at farmers markets or produce stands? Read the four options. And then lastly, Ms. Smith, I want to ask you about big box stores. You may not know what that means, but that's like a Sam's Club or a Costco or one of those kinds of places where you have a membership and you can, get good deals on food. And they have big, they have items with a lot in it, or in really good prices and that sort of thing. So then you do your four options. Next, you're going to move on and say, okay, I'm done asking you about places where you shop for food, but I want to ask you a couple of questions about the COVID-19 pandemic. So thinking about all seven of those places that I just asked you about, how often did you shop at these same stores for food before the COVID-19 pandemic as compared to now? And then you would give them the options of much more often before COVID-19, somewhat less often before COVID-19, somewhat. Okay, I just read those out of order. Sorry. Let me start over. Here's the response options. You go down this left side and then down the right side. So, Ms. Smith, would you say much more often before COVID-19? Would you say somewhat more often before COVID-19? About the same, either way. Would you say somewhat less often before COVID-19 or much less often before COVID-19? So again, you go down that left-hand side and then down the right-hand side so that it's in order. Technically, it doesn't matter. You know, their answer is their answer, but it just makes sense logically for it to flow in in some sort of ranked order. All right, next, Ms. Smith, I want to ask you, where did you shop before the COVID-19 pandemic as compared to where you shop now? So you're going to have an open-ended response there, and you're going to document their response. And then you follow up with, where did you stop shopping after the onset of COVID-19 pandemic and why? So you have an open response option in Qualtrics, and you just type in their answer or summarize that. Okay, now, Ms. Smith, I'm going to move to a different set of questions. I want to know about how you typically get to places to purchase your food. So here's the question, the big question for you. Over the past 3 months, how often did you use the following types of transportation to go food shopping? The first is your own car. Would you say never, sometimes, most of the time, or all the time? That's how you got to places to food shop. The next is getting a ride with someone you know. Never, sometimes, most of the time, all the time. So you just go through this list. Notice that we have, this one's pretty straightforward. Notice that we have an other category here where you can type something in. Don't know what that might be, but we want to make sure that we can capture unique transportation opportunities that people have. You may not ever get anything under other, but it's there just in case. All right, now, Ms. Smith, I want to ask you a few pandemic related questions related to how you get to places to shop for food. So here's the question. How different was your use of transportation to get food before the COVID-19 pandemic as compared to now? Would you say it's very different, somewhat different, about the same, or exactly the same? And there are some skip patterns, by the way, in this survey. So keep that in mind. And it's, again, it's going to show up in Qualtrics for you depending on how you answer. But this is an example where a follow-up question may or may not be relevant. So, Ms. Smith, what was different before COVID-19 pandemic about how you got to the location where you shop for food? So that would really apply if they say very different or somewhat different, right? So again, that's open-ended and you type that information in. All right, next, Ms. Smith, I'm going to ask you about other places where people sometimes get their food. Now, this, these may not be the usual places for you. These could be things that you use for a short period of time. But I'm just going to ask you about these other places where we know that people sometimes get food. So here's the big question for you. In the past 3 months, how often has your household depended on any of the following food sources? The first place is a food pantry. So this may be a church or a community center or something along those lines where they have free food that's given out. Would you say never, less than once a month, 2 to 3 times a month, or every week? A free meal at other community places. So notice that these are free meals that are already prepared, where a food pantry is they're giving you the food that you can take home and cook yourself. So free meals are sometimes given out at Salvation Armies and other community centers and even churches. So in the past 3 months, how often has your household depended on free meal sources to have food at home? Would you say never, less than once a month, 2 to 3 times a month, or every week? So then we just go through these one by one. So this is where I can begin to pick up the pace a little bit. Federal school lunch or breakfast program. In case you're wondering, a lot of school districts continued to feed kids and their families over the summer because of special funding during the pandemic. Hunting or fishing in the rural areas, and many of the counties we're working in are rural, and a lot of people get their food from hunting or fishing. Now, It's not really hunting season the past 3 months, but there could be food in the freezer from hunting. The previous deer season, which would have been the last fall. But fishing is definitely an option. Friends or coworkers or neighbors. So these are other people they know that gave them food, relatives outside the home, a community or personal garden. So this is just food from a garden. Uh, doesn't have to just be theirs. It could be a joint, like a community garden. Senior food center or distribution programs like Meals on Wheels. These would be things that cater to low income and or older adults. And then again, we've got this other category here. Ms. Smith, to wrap up this section, I want to ask you, how often did your household depend on this food assistance before the COVID-19 pandemic compared to now? So these places that we just talked about, how often did you get food from these places before COVID-19 compared to now? Would you say much more often before COVID-19, somewhat more often before COVID-19, about the same, somewhat less often, or much less often? How often did your household depend on food from hunting or fishing before COVID-19 pandemic compared to now? And they have the same response options here. How often did your household depend on food from friends or relatives before COVID-19 pandemic compared to now? So a few of those are just pulled out of that list and we're looking at. Now, notice this blue font here, which indicates to you that we're moving to a different section now. So the previous section was about where they got food. This section is called food security, and once we get into the content, it'll make sense to you. So the first one is actually a little bit tricky. Okay, so the first question says, or item says for them to rank the following items in order of importance when deciding what food to buy. Now, this is, keep in mind that all of the items that we have here, except for the COVID-19 items, these are standardized items that come from surveys that are collected all over the place. And so we can't really change the way these items are worded, but when we explain these items to people, we can take some liberty in doing that. So one of the ways that you can go about asking this, it's not really a question, it's an item, is to say, okay, Ms. Smith, I'm going to read you several different things that may or may not be important when you're trying to decide what food to buy. And I want to know, what would you say is the number one thing? So here's your choices: nutritional value, appearance of the food, price of the food, if the food is locally grown, or if the food is organically grown or grown without the use of chemicals. What would you say is the most important thing about deciding what food you buy? And then you would say, okay, Ms. Smith, what would you say is second most important? And you go through the four that are left. How about the third most important, the fourth most important? So, okay, Miss Smith, I just want to make sure the last option we have here is organically grown or grown without the use of chemicals. Would you say that's last on this list in terms of being important to you? Okay, thank you. I just wanted to verify that. That's all that's left here in our options, and just wanted to be sure that we're getting correct information. Would you say, Ms. Smith, that the way that we ordered these or ranked these things of importance for buying food, is that different now than it was before the COVID-19 pandemic? You answer yes or no. And here is a for sure skip question or skip pattern for you in the survey. How is the ranking different now compared to before the COVID-19 pandemic? And then you just enter their response. All right, next, Miss Smith, I am going to ask you about another block of things here. So here's the big set of instructions for you for this next part we're going to do. I want you to tell me how easy it is to access the following items in your community. So how easy is it for you to purchase or to get the following items in your community? The first set of items or category is fresh fruits and vegetables. Would you say not easy, somewhat easy, or very easy? Locally grown or homemade food items. Not easy, somewhat easy, very easy. And you go through the list. All right, Ms. Smith, thinking about the COVID-19 pandemic, how different was your access to these things we just talked about? How different was your access to fresh, locally grown food in your community before COVID-19 pandemic compared to now? Would you say very different, somewhat different, about the same, or exactly the same? And then lastly, I want to ask you related to this, do you have access to food through your own garden? Yes or no? They say yes, you put a check mark. A neighbor's garden? They say yes, you put a check mark. A community garden? They say yes, you put a check mark. Now, Ms. Smith, in the past 3 months, have you or anyone in your household had to choose between buying the food you need or paying for any of the following? Have you had to choose between buying the food you need or paying for medicine or medicinal care? Have you had to choose between buying food or getting gas for your car? Have you had to choose between buying food or paying your electric bill? How about other bills like childcare or other regular bills that you have? How about the rent or mortgage? So notice here that rent or mortgage is separate from other bills, so you got to be careful with that. So that might be, the other bills might be um, anything that's not utilities, um, but other services that they might get, that sort of thing, like trash pickup or I don't know. Something that's other than utilities or rent or mortgage is what the other bills are. So keep that in mind. Again, remember, anything that's grayed out, we don't offer that, but those are go-to answers if you have to use them. How often were you choosing between buying food and other necessities before COVID-19 pandemic compared to now? Would you say much more often, somewhat more often, about the same, somewhat less often, or much less often? So notice how I went through that a little bit faster because Ms. Smith's probably used to that kind of question by now. Would you buy fresh vegetables or fruit from a food truck or mobile market if there was one that came to your neighborhood or community? Yes or no? You document their response. All right, now I'm going to read several statements that people have told us about their food situation. For these statements, I want you to tell me whether or not the statement was often true, sometimes true, or never true for you or your household in the last 3 months. The first statement is the food that we bought just didn't last, and we didn't have enough money to get more. Was that often, sometimes, or never true for you and your household in the last 3 months? Here's another statement for you. We couldn't afford to eat balanced meals. Was that often, sometimes, or never true for your household in the last 3 months? In the last 3 months, Ms. Smith, did you or other adults in your household ever cut the size of their meals or skip meals because there wasn't enough money for food? Yes or no? So another skip pattern here, you go to question 26 if they respond yes to 25. Otherwise, you skip to question 27. So if they say yes, how often did it happen? Almost every month, some months, but not every, only 1 or 2 months. And then you would go to 27 or skip to 27 and say, in the last 3 months, did you ever eat less than you felt you should because there wasn't enough money for food? Yes or no? How often were you adjusting meals due to budget before COVID-19 pandemic as compared to now? Much more often, somewhat more often, about the same, somewhat less often, or much less often? So if they don't have children, you can skip down to question 35. So here, obviously, you have to ask them, do you have children living with you at home? Ms. Smith, in the last 3 months, did you ever cut the size of your child or any children living in your home of their meal because there wasn't enough money for food? Yes or no? In the last 3 months, did your child ever skip meals because there wasn't enough money for food? How often does this happen? Almost every month, some months or not, or some months, but not every month, or only 1 or 2 months? Document their answer. In the last 3 months, Ms. Smith, were the children living in your home ever hungry, but you just couldn't afford more food? Yes or no? In the last 3 months, did you ever choose to have less food for yourself to make sure that the kids had enough to eat? Yes or no? Now, keep in mind, these are very difficult questions. And so you may have some heart wrenching responses. So just be comforting to them. This could be a place where people may choose to not answer, for prideful reasons or whatever, but just don't push and don't probe on these questions, and just kind of, see what feeling you have about that as to whether or not you can clarify. And also here in questions like this, you may get some longer winded explanations, and sometimes people just need to talk these things through, and that's okay. So just try to be patient with them. All right, item 34. How often were you adjusting meals for your child due to budget before COVID-19 pandemic as compared to now? Much more often, somewhat more often, about the same, somewhat less often, or much less often? So they should be pretty uh, used to that at this point. Now, Ms. Smith, we're going to get into eating behaviors. So I'm going to ask you about things that you eat. So I want you to think about the foods you ate or drank during the past month. So the last questions that I was asking about, you had to think about the last 3 months. Now I'm asking you to think about the last month. So in the past 30 days, I want you to think about the foods that you ate or drink, including meals and snacks. Not including juices, how often did you eat fruit? You can tell me times per day, times per week, or times per month. So depending on how they answer, that's going to tell you which column you put their information in. Not including fruit flavored drinks or fruit juices with added sugar, how often did you drink 100% fruit juice like apple or orange juice? And again, they can tell you times per day, times per week, times per month. I won't read all of these because it should be pretty straightforward. Okay, Ms. Smith, how different were your eating habits before COVID-19 pandemic as compared to now? Would you say very different, somewhat different, about the same, or exactly the same? So if they were eating differently, so they would have to say very different or somewhat different, then you want to ask them how they were eating differently before the pandemic as compared to now, and then you enter their response. Okay, Ms. Smith, I'm going to ask you some questions about physical activity and exercise. All right. So these first questions are actually going to talk or ask you about walking to get places. In the past 7 days, so in the past week, did you walk for transportation? And what I mean by that is, did you walk to get from your house to work, to go do errands, to just go from place to place in general? This would include walking to or from a bus or train station or a bus stop. Now, a lot of these rural communities don't have trains. They might have bus stops if it's closer to the city. But again, we have to include this the way that it's written as best we can. So in the past 7 days, did you walk for transportation in any of those ways we just talked about? Yes or no? Got a skip pattern here. In the past 7 days, how many days did you walk for transportation? So they're going to give you a number from 0 to 7. On average, how many times per day did you walk for transportation? How long did that walk take on average? How long were you walking to get from place to place? Ms. Smith, sometimes we might walk for fun, to relax, to exercise, or walk the dog. But in the past 7 days, did you walk for any of those reasons? Just for fun, just to relax, to get some exercise, or to get your dog out and about? Document their answer. In the past 7 days, how many days did you walk for leisure or exercise? So if they say exercise up here, walking the dog would also be leisure, fun, relaxation. All these things, it's going to fall under leisure or relaxation. That's why we have a skip pattern. In the past 7 days, how many days did you do that? On average, how many times per day did you walk for leisure or exercise? That would be that list of things we just talked about. How long did that walk take on average? How often were you walking for transportation and leisure before COVID-19 pandemic as compared to now? So notice that we have a set of questions asking about transportation, a set of questions asking about leisure. So we fold those together in this COVID-19 question. Much more often, somewhat more often, about the same, somewhat less, much less. You've seen that before, and so have they, right? All right, next missed question. I'm going to shift gears a little bit here, and I'm going to ask you about your neighborhood and community. So these next questions have to do with where you live. And what I mean by that is your neighborhood or places near your home. So the first question is, how often does walking for leisure or transportation take place near your home? Would you say almost always, most of the time, some of the time, never? Document their response. Where you live, are there roads, sidewalks, paths, or trails where you can walk? Yes or no? Notice that these are shorter, simpler questions, and this is where the pace can pick up a little bit. There are other sections that may take you a little bit of time, especially early on in the survey. Are there bus or transit stops you can walk to? Are there places like movies, libraries, places of worship? I won't read all of these because these are so straightforward. Does crime make it unsafe for you to walk? Do dogs or other animals make it unsafe for you to walk? Now we've got some more physical activity questions. You don't necessarily have to make a transition here per se, but actually what I would do when you get to this behavioral risk factor surveillance system, this is a national survey that's done in every state by public health agencies and the CDC. What you can do as a transition here is say, okay, Ms. Smith, I'm gonna ask you about some activities that you may do or exercise that you may do that would include walking, but could also be things that aren't walking related. So here's the first question. During the past month, other than your regular job, did you participate in any physical activities or exercise? And here's some examples for you, like running, calisthenics, golf, gardening, or walking exercise. So if they don't know what calisthenics is, hopefully you do, but that's, typical body weight exercises like jumping jacks, push-ups, sit-ups, things that you can do without equipment, essentially. So yes or no, did they do that in the past month? Got another skip pattern here. Now, this next part looks very confusing the first time you see it, but here's what you're going to do. You have all these different categories that you can put their answer into. You do not, please don't read all of these, okay? But and don't worry about the numbers that are beside them and that sort of thing, because that's just coding stuff. But here's what you do. You want to open-endedly say, what type of physical activity or exercise did you spend the most time during the last month? And just let them tell you. And you want to pick like the number one thing, the predominant or primary thing that they did. And then you're going to find that on this list, and you will become familiar with this list in short order. So there's all sorts of things listed here. I know some of these seem silly, like Frisbee is like really, really specific. But again, this is standardized, and so we can't really change this too much, although we have added a few things, which is okay. Karate and martial arts, for example, is I don't think that's part of the original list, but anyway, notice that there is an other here where If there's something that you just can't categorize with all these options you have here, that's your go-to. All right, so thinking about, Ms. Smith, that thing that you have done the most in the past month, um, that activity that, excuse me, let me start over here. So, Ms. Smith, thinking about this activity that we're talking about, that is your primary physical activity outlet or your primary exercise thing that you do, how many times per week or per month did you do that activity? And then you would indicate times per week, times per month, um, based on what they say to you. And when you took part in that activity or that exercise, how many minutes or hours did you do that on average, like each time you did it? And then you put their response in. Ms. Smith, were there any other types of physical activities um, that gave you maybe, your second level or the next most exercise during the past month? Coming out of character here for you just a second. I know this phrase that gave you the next most exercise is really odd, but what we're trying to get to, and you can paraphrase this in a way that you think makes sense or can get it across to them, would be like, what's the second, if some people only walk and that's their exercise outlet. And a lot of older people do that, for instance, just a lot of people in general. So there may be people who just walk. But there may also be people who walk or jog or run, but they also do some kind of weight training, whether it be body weight or whether actually they're using free weights or machines or whatever, right? Or any other kinds of things. They may play a sport for fun. They may do yoga. Probably a lot of these people are not skateboarding, but this is a list for really a broader audience than who we're specifically targeting in this survey. But we want to know like the number two thing that they did. So this initial set back here was like their primary physical activity exercise outlet, and this is the second thing, if at all, if there is a second thing. And then we're going to ask them how many times per week or month, how many minutes or hours did they usually do it each time. And then lastly, we want to know how often they were doing these activities, the second most prevalent activity that they do before the COVID-19 pandemic as compared to now. So at this point, I'm kind of paraphrasing. I'm out of character. I'm not doing the interview. So let me go back into character here. All right, Ms. Smith, I want to now talk to you about stress. So we're moving away from activity and exercise. So here's the first thing I want to ask you. Thinking about the amount of stress in your life, would you say that most days are not at all stressful, not very stressful, a bit stressful, quite a bit stressful, or very stressful? Notice how that goes from low stress to high stress. Some of our other response options might have been, so this is like going from positive to negative. Some of the other responses previously in the survey might have been more negative to positive, but just notice things like that as you work through the survey. How was your stress level before the COVID-19 pandemic as compared to now? Would you say much more stressful, somewhat more stressful, equally as stressful, somewhat less stressful, or much less stressful? All right, Ms. Smith, those are all the stress questions. Now I'm going to ask you a few questions, and we're almost done here, by the way. I'm going to ask you a few questions about the broader community where you live. How would you describe your sense of belonging in your local community? Would you say very strong, somewhat weak, or very weak? Now, this one might be a little bit confusing to them. So they may ask, what do you mean by sense of belonging? And what that means is, how well do you feel like you fit in? Like this is your place that you're supposed to be, that sort of thing. So you don't want to be too specific in defining that for them. You want them to really sort of process that themselves. But If you're pressed and they're not understanding and you need to give them a little bit of help, use words and phrases like I just used, like, you fit in to your community. It's the place you belong. Would you say that uh, your sense of belonging or your fit is very strong, somewhat weak, very weak? All right, now I'm going to ask you about other people in your neighborhood. How strongly would you agree or disagree that people around your community are willing to help their neighbors? Would you say strongly disagree, agree, or strongly agree? How strongly would you agree or disagree that you live in a close knit neighborhood? Strongly disagree, strongly agree, strongly agree. Here's the next statement for you. People in this neighborhood can be trusted. Would you strongly disagree with that? Disagree, agree, strongly agree. That's, I'm giving you another way of presenting this over the phone. Here's another statement for you, Miss Smith. People in this neighborhood generally don't get along with each other. Would you strongly disagree, agree, or strongly agree with that statement? So that's yet another way you can present this. So remember, that they can't see these items and responses. So you have to work a little bit harder as a phone interviewer to communicate that with them. And again, try to be conversational. The way that you do that, you've got some flexibility, um, but I'm just trying to give you several different options where the essence of the item or the question is not changed in any significant way, but I'm doing it in a way that I feel they'll understand it. All right, next I want to talk to you about how likely you would say that neighbors know each other well enough that they can be counted on to help out or intervene in certain ways. So some people may not know what intervene means, so you can just say help out. So how likely would you say it is that neighbors know each other well enough where you live that if children were skipping school or hanging out on a street corner, that people would step in and let others know or to do something about that? Would you say very unlikely, unlikely, likely, very likely? Here's the next scenario for you, Miss Smith. Children are spray painting graffiti on a local building. How likely is it that neighbors know each other well enough that they could be counted on to tell each other about this or make others uh, aware of this? Would you say very likely, unlikely, likely, very likely? So I won't read all these to you. That should do the trick. Okay, wrapping that up, Ms. Smith, how likely were people in your neighborhood to help their neighbors before COVID-19 pandemic compared to now? Much more likely, somewhat more likely, equally likely, somewhat less likely, much less likely. How likely were people in your neighborhood to help out or step in or intervene when necessary before the COVID-19 pandemic compared to now? Would you say much more likely, somewhat more likely, equally likely now, somewhat less likely now, or much less likely now? And then lastly, Ms. Smith, we're just wrapping things up here. We're pretty much done with the survey, and I just need to ask you a few more questions so that we can finish this and I can get that Walmart $10 gift card off to you. So I'm going to ask you a few questions about yourself, um, just so we can have an idea of and describe all the people as a group that we have done the survey with. What is your age in years? Put their response. What is your sex, male or female? It's possible that someone does not identify as male or female. So keep that in mind. That would be a refused, or you could make notes about what their answer is. Ms. Smith, are you Hispanic, Latina, or of Spanish origin? Yes or no? So notice there's another skip pattern here. You go to question 77 if they responded yes, but otherwise you skip down to 78. So if they say that they are Hispanic, Latina, or Spanish origin, you're going to clarify that, right? If they say no, then you want to identify if they're white, Black or African American, American Indian or Alaska Native, Asian, Pacific Islander. Again, we don't offer the don't know and refused. Ms. Smith, are you married, widowed, divorced, separated, never married, or a member of an unmarried couple? Ms. Smith, are you currently employed for wages, self-employed, out of work for 1 year or more, out of work for less than a year, a homemaker, a student, retired, unable to work? Again, keep in mind, this is a really good example of where you're running through the list of options and they'll just say, I'm retired. And then you don't have to read all those options. So this next question is one out of character here again, where people may be have some difficulty giving you an answer, or they may be ashamed, or it may be too private. So one of the ways that you can do this, let me model one way of doing it, and then I'll give you another option. Ms. Smith, is your household income from all sources less than $10,000, $10,000 to less than $15,000? And then you just read through this list. I won't read everything. The other way that you can do this would be kind of like the physical activity questions, where you might say, Ms. Smith, can you give me an idea of your household income from all sources? And if they throw out their estimate or their figure to you, they may know this exactly. They may be someone in the household who does not know that information because they don't handle the household finances. So keep that in mind. You can run into that. But a second option for asking this question might be to ask them if they can remember their household income, like last year when you filed your taxes. How much money did your tax documents say that your household made, or if it's you and your spouse, or someone you're married to, or if it's you filing by yourself? You can ask them that amount and then you place it in the appropriate category. So option one is to read the categories, let them pick. Option two is to ask them the amount and then place it into the category as you did with the physical activity questions. Almost finished, Ms. Smith. Just a couple more questions. How much do you weigh without shoes? Again, sometimes people may refuse that one. How tall are you without shoes? What is the number of people in your household? How many adults are there? How many children younger than 18 years live in your house? All right, lastly, Ms. Smith, I want to ask you how you heard about our survey. Now, you're going to get all sorts of responses here. You may get a specific person's name. You know, Sally Johnson that works down at the health department gave me a number to call. Or, you know, John Smith at the medical office gave me a flyer, or I got one at my doctor's office or at my church or whatever. Try to get as specific as you can with this answer and document that, because we really want to have some way of tracking how the word gets out in these communities, and we can leverage those communication resources in the future, in other studies and in other work that we do in the community. But anyway, that's the last question. So this is where you go. Ms. Smith, thank you so much for your time. I know it took a little while to get through all those questions, and I really appreciate it. So what I need to do is just document the mailing address that you want your $10 Walmart gift card sent to. I want to make sure that that gets to you. So I want to make sure that I get this right. And as soon as possible, we're going to get that mailed out to you with a copy of the consent form that we did at the very beginning. Thank you very much, Ms. Smith. And then you finish up. All right, so let me go back to sharing the slides here. All right, so I just basically went through all of these. In the slides here, I've got for each section just a summary of what kinds of questions we're asking or what kind of items we have. So I can skip through that now. You can refer back to that as you need to. There's another misspelled word. Too fast typing this morning, I guess. Okay, so please don't judge me for this. Where do I find my assignments? So go to Clemson Box, just like we did a few minutes ago. You're going to have to do the two-factor authentication, which I know you're probably sick to death of. Go into the Food and Wellbeing Survey 9 Counties folder. I've already shown you that. Go into the Community Survey Recruitment Interview Payment and Tracking Form. This is one of the Excel files that you'll find in there. It's the one with the longest title, I believe. When you open it using, you'll have two options. Choose Excel Online. Go and find column H. Hopefully that's correct. H or I. It's the one that says person assigned to. And then find your name and look within that row to get the person's name and their contact information. And then as you make your calls, you can complete the surveys and complete your surveys. You can be sure that you add any relevant info that you need to back into the Excel file. So if you called 3 times that evening and you're shutting things down for the day, you tried to reach that person 2 or 3 times that night, but didn't get through to them, you would document that in the appropriate column. Again, we looked at that earlier. If you completed it, you would put a yes in the column that it was completed, and then you would go back in the column beside the county where they live. You're going to put in the mailing address that we need to get their gift card out to them. This is a very, very important point that I want to make here. Do not ever sort the file in the online Excel view and save it using Excel Online, because that's going to screw everything up. Pardon my phrasing there. If it can potentially really mess things up if you don't sort everything together, right? And we want to keep a standard format that every person who has access to this file is expecting it to look a certain way. Feel free to save the Excel file to your local computer, and then from there you can sort and do anything that you want to do. As a matter of fact, it may be easy for you to sort and just look at the block of names that you have to work from, but then just go back into the online Excel file, make your notes, and then you save it as the name that it's already given. So you're going to save over it. So you're basically adding to. You should be familiar with how to do things like that. If you're not comfortable doing that or don't understand what I mean, make sure you get in touch with me before you attempt to do that, and I'll help you through it. Now for data entry, you've got 2 options. And I've already mentioned this, but just want to make sure that we cover it again at the end. You can print off a hard copy of the surveys and document responses. Then you would go to Qualtrics and enter the data by hand. So this is more work, obviously, takes a little bit longer. But your second option, which is more efficient and can be done more easily, is to go to Qualtrics and enter the data in real time as you survey the person. So let's go to that link and see what it looks like. So as this is set up, this is how you do the unique identifier. So you've got 1 through 9 or 0. And we shouldn't really be using this 0. The 0 is like when we do this as a practice run, okay? That's why that's there. So they should live in one of these 9 counties. And these counties are alphabetical here. So the county code is going to be a single digit that you put here accordingly, based on what they tell you where they live. The last 4 digits of their phone number go here. And then your initials. So Sarah Griffin would be SG. Doesn't really matter if that's capital or lowercase, but this is what we'll use as a unique identifier for each person. Next, you're going to go into what county do you live in, and you highlight that or select it. Um, and again, we shouldn't be using this other. And then you go to the next screen. What is your zip code? There's already some in here to choose from, but then you can also do this other and enter that. Where do you shop for food? You type that in. What stores? You type that in. Go to the next thing. And then this should look familiar based on what we just went through in the training. And notice it's very nice how as you go through each one of these things in this block of questions, how it keeps you on that row so that you don't mess things up, right? So then you're just entering responses here, okay? And then you can always go back if you need to, right? That sort of thing. But it's just easier to have this up and do it as you're on the phone with them. And you're entering that in real time. Okay. All right, so here's the next steps for you. Send me an email. Here's my email address. And tell me what days and times you can make calls. Now, I mentioned this earlier in the training, but I want to say it again. Don't limit yourself to just a few hours. You know, even if you're working on this project at a minimum load, give me all the days and times that you can call, Monday through Friday, including the weekend, whether it be morning, afternoon, or evening. And I will take that range that you give me and I can assign you people accordingly. Again, it's up to you to stay on task with making sure you're putting in those 4 or 5 hours a week or 20 hours a week, whatever your arrangement is. And so the number one thing is making sure that you're giving us the amount of time that your agreement with us indicates that you've committed to. But also on the other side of that is make sure that you don't do too much work. Okay. So it's up to you to be, you know, an independent contractor, if you will, and track these things and keep up with that. If you ever have any problems, especially something that's urgent or even not urgent for that matter, you can call me or text me. This is preferred over email because if there's something that you need help with, it's very possible that I can miss an email. I'm usually pretty good about that, but like most people, it's a real possibility, unfortunately. All right, so that is all for the training. You know how to get in touch with me. Thank you so much for your willingness to participate in this. And again, you know how to get in touch. I'm here to help. That is my job.